So let's now look at maximizing our hygiene schedule productively. Okay, assisted hygiene, you've heard that mentioned, and we actually have an Assisted Hygiene Academy on our member site. So if you want more information about the specifics about what we do, you can seek it out there. But here's why assisted hygiene can make sense in some scenarios. We've studied this, and an assisted hygienist can lower overhead by about 20% with the same patient base. So it can dramatically reduce your overhead. If you are in an area, a market, where your hygiene salaries are way out of your profitability threshold, assisted hygiene can help make up for some of that. Okay, and an unassisted hygienist in one op can see roughly 7 to 8 patients a day, depending on the service mix. An assisted hygienist in 2 ops with a dedicated assistant can often see between 13 and 16 patients a day, depending on the service mix. Okay, so assisted hygiene, again, lowering overhead. Providers have more time to educate patients. We have more time for case acceptance and preheating the patient. And I know that might seem silly because you're like 11 to 13 patients or 13 to 16 patients. Honestly, you have more time to have discussions because you have somebody else picking up all of the other things that divert and distract our attention. Okay? And that's key when we think about doctor restorative capacity. If we have lower restorative capacity on the doctor side, assisted hygiene makes sense because we're driving more patients through. Dentistry is a business of flow. So as those patients come through, we'll find more restorative needs, and it helps improve demand on the doctor's side. So we do see more opportunities for same-day prevention, and we see they're more often completed same day because we have another set of hands with which to help get those things done. So it's important to note, and this is what I would say to the new hire or anyone who's questioning assisted hygiene as a model. In our world, we've got to be careful how we define assisted hygiene. Some people may be thinking accelerated hygiene, which is hard on your body, all of those things. Accelerated hygiene is different than assisted hygiene in our definition. Accelerated hygiene is 30-minute appointments, 40-minute appointments, and no assistant at all. It's getting them in, getting them out. It's more like the Prophy Palace or the cattle call. But that's what people think when we say assisted hygiene. They don't understand there's a distinction. And the most important distinction in my book is that the patient is still scheduled for a full hour. We're not cramming patients through faster. The hygienist is not performing a faster Prophy or shortening treatment times in an assisted model. We're just delegating some of the tasks during that appointment to an assistant, much like our doctors do. So when they say it's harder on my body, I could argue with that a little bit. I guess you could say, yes, you are treating more patients. But in my opinion, if dental hygiene is hard on your hands, or if you're worried about carpal tunnel, you're just not using your instruments effectively or appropriately. We've got to use our power scalers more effectively in that moment. Now, as far as head, neck, and back massage, we're all screwed anyway. Right? I mean, come on, let's be honest. So hopefully yoga, stretches, massage, hopefully we're taking care of ourselves the best way that we can in that regard, right? I mean, that's important, right? It is important. But I would argue that assisted hygiene in many ways helps with that. It helps with that because we're not running as fast as we would need to without an assistant. Okay? Increased effectiveness, increased efficiency equals increased productivity. So for hygiene providers that are set up on some kind of production-based compensation model, as we believe strongly that every hygienist should be, this is how assisted hygiene makes sense. We have an opportunity to earn a bigger future. We're not demanding a bigger future, but we have the opportunity to earn it. Right? So we know some assisted hygienists that are making 6 figures. It's possible, okay? And it's awesome when we see days like that. Okay, again, as we mentioned, 70 to 75% of our restorative production on average is referred from hygiene. So the more patients we have flowing through the office, the more we are able to effectively fill the restorative schedule, which is why assisted hygiene doesn't always make the most sense, right? Assisted hygiene doesn't make sense if we're out of doctor capacity. Because if we're out of doctor capacity already, the last thing we want to do is increase the flow through the office until we address the doctor capacity shortage. Okay, if we're out of treatment rooms, we may need to get creative about when we do assisted hygiene. So we can still do assisted hygiene, but we've got to be creative about when we do it. Okay, so I know a practice that used to have hygiene 5 days a week, but since COVID hit, they lost providers and only have providers on 3 of those days. So what they did was they shifted to an assisted hygiene model on the days where they had hygienists available, and they eased up on the gas on the restorative on those days, highly productive procedures, less doctor restorative flow, and on the other days where they were not fully booked with hygiene, where they had no hygiene on Tuesdays and Thursdays, what did they do with the doctor's schedule? They expanded it. So you can get creative about how you utilize your schedule and how you use the assets and your providers and all those things, okay? So if you don't have a superstar assistant, don't do it. It's that important. I know personally of one hygienist that retired, and I said, what did it for you? And she's like, I was just done. I had 7 assistants, new assistants, over an 18-month period. It's exhausting. You know, every time we get an assistant up to speed, they're kind of taken from the doctor's side, and we have to start over. That's not necessarily the best strategy, in my opinion. Again, if 70 to 75% of the restorative is referred from the hygiene department, who do you want assisting the hygienist? One of your best. You want the best communicators, the ones who have long-term relationships with patients. You really want, for me, as an assisted hygienist, I wanted to show up in a way, kind of function like the doctor. Like Dr. John said, I don't even know what comes next, I just do it. And that was me with my schedule. I didn't even look at it. I just went where they told me. We got it done. You get into that space of flow with your assistants, much like doctors do, and you're just taking care of people all day long. I'm not having to worry about the details of the management side. I'm just focused on patient care completely. Okay? If you have to have the assistant shared with the doctor, don't do assisted hygiene. It does not work. You have to have it, unless you have a floater that's assisting 2 or 3 hygienists. Like, that's not an assisted model, right? Because you still have the same amount of patients in your schedule. If you're asking your hygienist to manage 2 columns, they have to have a dedicated assistant. Now, I have seen it work well. Let's say we have 3 providers that are managing 4 or 5 columns with a floater. That can work. Or 3 hygienists managing 4 or 5 columns with at least a dedicated assistant. There should be, in my opinion, a provider for each column. So if we have 5 columns of hygiene and we have 3 hygienists, we should have 2 assistants. Does that make sense? So as long as we have a provider for each column, no one's going to be left alone. And it can work really, really well. Okay, so most critical part is the communication and how we communicate, which is why I asked Lisa about patient's perception when there's 2 of us, because we have this fear that patients are going to feel like they receive less than optimal care, and that's just not true, especially if we communicate it in this way. Today, you're going to have 2 dedicated team members taking care of you instead of just 1. Together, we're going to make sure we serve you better than ever before. And with that kind of communication, patients don't feel less than. In fact, when we did a test and we surveyed patients, more than 87% of them rated their service as higher than before when it was 1 dedicated provider. So that's big, okay? So common mistakes that we see, if we have a negative opinion or a hygienist that has a bad taste in their mouth because of an assisted hygiene model in the past, usually it's because of one of these things. They were given somebody who didn't really understand or know how to assist. Hygienists, sometimes we have a hard time learning how to delegate, and so we end up running behind because we're still trying to do everything ourselves, and that adds to the stress level. Here's another critical focus. If you have an assisted model, there has to be a strong, strong focus on handoffs. The last thing we want to do is have an assisted model, up the flow, and see our case acceptance or our diagnostic drop because no one's paying attention to that part of it. So handoffs are critical, okay? And that's why I think it manages itself really, really well if we have the right people. And again, try your very best not to steal away the hygiene assistants. Let them establish a relationship, get in the groove, create flow, incentivize your hygiene assistant as well as your production-based compensated hygienist. And what that does is that creates a desire on the assistant side to elevate patient care, just like you've created within your hygiene team. Okay, so we could go through, sample templates. We're not going to get into that level of detail, but here's a quick example. When you're first learning how to do it, like Dr. John said yesterday, you might want to follow some kind of a template like this. But hygiene team, when you've done assisted hygiene for a while, I don't even care where they are in the schedule, we're going to make it happen. So we didn't have a stagger. We just had 2 columns straight through. Assistant would start with one, I'd start with the other, we'd switch. Like it worked out well. But at first, especially if you're trying to minimize overwhelm with your hygienists that have never done it before, use a template. Stagger the appointments until you get in your groove and you feel comfortable with how you're caring for people. Okay, we actually have this on the member website, Scheduling Helps for Assisted Hygiene. So it's a 2-page document. So if you want more information on how to schedule assisted hygiene, go find this tool. If you have a struggle finding it, talk to your coach.